Hello again, this is Dr. Joseph Shumelian. This is video number 4 in our series, which we've entitled Keyhole Mini Implant Dentistry for Missing Teeth. In fact, in this video we're going to take a look at how we can stabilize a full set of dentures, a full set of teeth, for patients who are missing an entire set. Often, before patients have to have the rest of their teeth removed, they're faced with a situation where they're wearing a reasonably large acrylic denture anyway, which overstresses the adjacent teeth and eventually leads to the loss of whatever is remaining. In this case, the last 3 teeth were subject to loss, and had they been lost, more often than not, most dentists would provide a full upper denture as a result. But however, with keyhole mini implant dentistry, this patient was able to overcome that potential risk and have a full set of non-removable teeth attached by these mini implants, as we've looked at in the previous video. A lovely outcome, nothing covering the roof of the mouth. Porcelain teeth all the way around, attached to wonderful supports in the form of mini dental implants. However, for those patients who've lost all their teeth and the roof of the mouth is covered with a full denture, it's quite a frustrating situation. You can see the complete loss of teeth in this situation, and often this is the dentistry that most practitioners will provide, a full set of dentures. Not the most ideal, very difficult to cope with initially, especially the lower teeth, which are often very loose due to the shrinkage that occurs in the bone structure of the jaw. Unfortunately, in the past, dentists could only extract teeth and replace them with these sort of acrylic dentures. However, we have come a long way since those times. For patients who have the misfortune of losing all their teeth and who really cannot afford to have bridge work in the form of porcelain teeth attached to multiple implants, there is this option. We can stabilize the dentures using 6 mini implants in the upper jaw and 4 in the lower jaw. Stabilization of complete dentures requires 2 elements: the implant, which is secured into the jaw bones, and the housing, which is secured into the denture. The housing fits precisely over the top of the implant and has a rubber O-ring inside, which fits over the little ball and connects it very securely. Here's a little diagram indicating that the housing's in position. The housing is placed in the denture while the implants are positioned in the jaws. The denture must be hollowed out, specifically where those implants are seated, and after being precisely hollowed out, an acrylic is placed inside the hollows, and that acrylic hardens and picks up the little connections inside the undersurface of the denture. Here you can see 6 connections, each of which has a little rubber O-ring inside, and it's the O-ring that does all the work, all the retentive work around the implants. In the lower jaw, only 4 are required. 4 connections stabilize the denture beautifully. The beauty of this technique is that patients wearing complete upper dentures can eliminate the need for the palatal coverage. The section in the denture, which sits up against the roof of the mouth, can be removed, allowing patients to sense the textures of foods and the temperature of foods, and deriving much more pleasure from their eating experiences. In the lower jaw, as I mentioned earlier, only 4 implants are required, and the housings are positioned inside the denture to precisely fit on top of those implants. Here you are with the final result. One of the things I have to mention is that the upper jaw has a much softer bone structure and is more prone to failure of the implants, hence the need to spread the load over 6 implants rather than 4. However, even if we lose 1 or 2 of the implants in the upper jaw, the denture is still very secure, as you will hear from this patient's testimonial.
I had my titanium plugs put in December 2010. Didn't have a problem. Done it under sleep and went through, no pain. With my new dentures, 10 days later, one of the plugs was a little bit loose when I pulled my teeth out. It wasn't that uncomfortable. I unscrewed it. It's now been 14 months later. I eat what I like to a certain degree. I don't eat toffee apples or anything that's too hard. Don't have a problem, no bad breath, easy to clean, and the ease of taking them in and out, and yeah, fantastic. Been back to see Dr. Shumelian, and he said I've maintained them well. I don't have a problem. I'd do it all again if I had to.